abuse of prescription drugs in our teens or in our family members, we have signs of abuse, but the issue is it's much more difficult to try to see the abuse of a prescription drug than it is of a typical drug that you'd be abusing, because the drug interactions are going to be very, very difficult to try to anticipate, and the overall behaviors are going to be very, very different. But we have the usual signs of abuse: changes in grades and attitude and sleep. Eating patterns, specifically, I think are probably a good thing to look at. Medications disappear from the house or your medicine cabinet with no explanations. And then, again, some usual, I guess, if you will, signs of abuse as far as dilated pupils, sweating, nausea, slurred speech.
Or pinpoint pupils as well.
Yes.
Either.
And that's depending on what we're looking for. You're looking for, if it's a pain reliever, you're more likely to see pinpoint pupils, whereas a stimulant abuse you might not. You might see more cardiac types of symptoms. Depressant abuse, dizziness, respiratory depression, slurred speech. And again, all those things are without the addition of things like alcohol. So in safeguarding our drugs, again, it's not just a matter of keeping your own house, clear and clean, if you will, but it's sharing this information with other relatives and other family members. Safeguarding your drugs, setting rules for your teen, and then following them yourself. So it's a matter of don't share drugs with your sister-in-law if you're going to encourage your child not to. Properly discarding of older unused medications, and I'm going to hit on that before I leave. And then ask your pharmacist about medications. Ask your pharmacist about refills. Your pharmacist can print out a list of any drug that you've had filled or refilled for the past, however long you'd like to look at it. So on a quarterly basis, go through and see what your family members are having refilled, because you may in fact be surprised at the fact that, I didn't really think that we got so many refills on that particular product, and you do, because when you establish a relationship with your family pharmacist, you're going to go and say, my mom needs more of her, whatever, can you fill it for me? And if it's a $5 or $10 copay, it's no big deal. And if you're not keeping track of it, you're not going to really remember. So disposing of medications. So if you in fact have prescription medications or even non-prescription medications that you need to get rid of, one of the first things that they'll tell you to do is take it out of the original container, primarily because the original container is going to tell everybody what it is. And if it's a prescription medication, it's going to have all of your pertinent information on it. It's going to have your name and your address and the name of your doctor, and it's probably just better if you don't do that. So you either remove it from the container or take those labels off. Mix them with an undesirable substance such as cat litter or used coffee grounds, so it will make them very unattractive, unappealing, and sometimes unrecognizable. Put them into some kind of disposable container that either has a lid or that you can Ziploc close. Again, removing your personal information, and then put that container in the trash with your regular garbage and send it out to the trash. There used to be a big push to make sure that to let people know you could flush your medications. Well, now we have the DEA in conflict with the EPA, and so I'm not really sure who's got the initials at one on that one. But we are not recommending usually that you would flush those medications because of the fear that it will go into some kind of a water supply. Although, just again, to close the circle on that, the majority of drugs that wind up in the water supply get there as a result of our putting them in the water supply because we urinate or defecate out drugs. And that's where 99% of drugs get into the water supply. So, we can dump a lot of Zoloft and a lot of Paxil in the ocean, but we're actually doing it without really thinking about it. So it's one of those things where I really think that it literally is a drop in the ocean if by pulling it out. But anyway, that's just another talk for another day. Right. So the DEA has now partnered with healthcare facilities and groups across the country now for the last 2 years to do a program where people can bring their drugs in. Again, because it's a matter of, we don't have a way, if someone, dies, if grandma dies and she's got, 6-8 months worth of drugs in her medicine cabinet, we don't really know what to do with them. By law, again, if they are controlled substances, I can't take them back in my pharmacy. Many times people will do that just as a courtesy. I have done it myself as a courtesy, but technically it's not something that we can do, and you actually really could kind of, depending on you can get in a lot of trouble for it. And then what do you do with it? Now you have this big box of drugs in your pharmacy, so what do you have to do with it? And technically they have to be incinerated. But the DEA now, twice a year, will actually set up these drop boxes where you can actually come and dispose of your medications, no questions asked. The DEA agents man the boxes, and you can actually come in and say, here you go. Here's everything that I need to get rid of. And they were actually very, very successful. We had 208 prescription collection sites in the last drug disposal day that we did, over 4,000 nationwide. So there's a number of places. Every hospital within the North Shore-LIJ health system actually participates in this. So we usually have the DEA agents hanging out in the lobby with these big coats on that say DEA agents. So it's a very well-behaved lobby during the day. Nationwide, in our last collection, we had 121 tons nationwide collected. I have a friend who flies aircraft carrier, who flies airplanes for a living. That's more than a fully fueled aircraft. 800 pounds of medications were distributed were collected in Long Island. Almost a quarter of that came from the North Shore-LIJ health system. One of the things I did not know is that unwanted and unused medications can be dropped off at any Suffolk County police station 24/7, no questions asked, and they will actually incinerate them. We are actually working with the DEA both on a federal and a state level to be able to offer these on a more regular basis, or at least to be able to have specific drop boxes that are secure within safe places such as hospitals or police stations, where you can just come in and drop it off, and people can't get in. Once it's in, you can't get out, and there's only certain people who can go in and actually access that medication. So we're looking at some legislation to help that. The next DEA Drug Take Back Day is the 29th of October. And again, I believe that Staten Island University Hospital will be participating in that. One of the slides actually I did not include here is one of my favorite slides from the very first Drug Take Back Day. From a take-back site in Colorado, there literally was a vial of Quaaludes that was turned in. Because Quaaludes back in the 70s were illegal.
That's a great story.
I will send you guys the vial. I mean, and all I could think of is, man, that vial would make a mint on eBay. Because it was in the original container. It was fabulous. Because again, Quaaludes used to be legal, and that's how long whoever had this had been holding on to this.
That's a great story.
So, and the last thing I will leave you with is a medicine cabinet inventory. Beg your pardon? Oh, fabulous. So it's a way, again, to kind of keep track of what you have when you especially if you're dealing with people who have a lot of medications that they have available and that they have around. So it's a way to keep track so that you actually will know what you have. I've got some websites up there that you can contact. My email and my sometimes I do this for I guess high school students now, so I had to give them a way to contact me that didn't involve actually verbal communication. So I had to give them my email and a way to text me, because apparently no one talks on the phone anymore. They just text. Now my father would have been very happy to hear that, because I can't tell you how many hours I spent on the phone, so that he just didn't want to listen to it anymore. So now we don't talk on the phone, we just text. So there's a lot of information that's out there, and I think that just having programs like this and communicating it, participating in the DEA Drug Take Back Days is a way to really make this problem something that people are able to talk about, and we can start trying to fix it. So thank you for your participation. It was wonderful.